Misdiagnosis for me is a lifetime challenge because I live with a chronic heart condition called hypertrophic cardiomyopathy. It feels a lot like having one foot on the brake and one foot on the gas. I go ahead and I feel somewhat normal for a while, and then something crops up. I may go through a bout of atrial fibrillation, or I have sleep disorders, or I may have blood pressure problems, or I may get tachycardia. And so it's during those times that I have to check back in with my health providers. They may not have an answer either. So oftentimes I'm the one, as living with a chronic health condition, that I have to know as much about my body, it seems like, as any medical doctor that I've encountered. But when there's an inaccurate diagnosis or a drug that we're not sure how it works or a procedure that may be hopeless, that can be really, really scary. Looking back as a young woman with a genetic mutation that has led to hypertrophic cardiomyopathy, before I was accurately diagnosed in my 20s, and so just dating back, that is in the mid 1980s. Oftentimes, when I went in for a physical, whether it was to be on a cheerleading squad, whether it was to be on a dance team in college, oftentimes in a small town in Kentucky, you'd have a GP that would just do a basic physical. I was told she has mitral valve prolapse. She's going to be fine. I was even told at birth, my mother was told at birth, that the murmur was insignificant. And so I went through an entire childhood with a condition that actually could have caused sudden cardiac death. And it wasn't until I reached out to a cardiologist who understood the complexities of hypertrophic cardiomyopathy and understood my symptoms were more severe in my 20s was I accurately diagnosed. How do we accurately diagnose? So it might be a valve disorder, it might be atrial fibrillation, it might be a chronic ventricular tachycardia, it might be some type of sleep apnea. So, with a chronic heart condition, there's always the need to accurately diagnose secondary conditions that have an impact on my health. There are a lot of things that health providers can do to make sure that women are accurately diagnosed with heart disease. I think first and foremost is to recognize that even though popular ideas are that heart disease is a man's disease, that's just not true. That women are equally, if not more so, likely to be diagnosed or have symptoms and ultimately have conditions of heart disease. So, this idea of men in a white collar job sitting at a desk all week and then going out on the weekend and shoveling snow, then having crushing chest pain just doesn't often or many times apply to women. Women have different symptoms, and that needs to be taught in medical schools, discussed, and every woman needs to be evaluated for their unique signs and symptoms, not to be brushed off that things are just in their head. And if you have a complex condition like I do with the genetic mutation that creates a lifetime of challenges, you want to make sure that the center you go to specializes in that care and asks pointed questions to make sure they understand your cardiac condition.